Dental implants are probably the most advantageous aspect of replacing missing teeth. When patients have a denture, removable denture, dentures only provide about 10% of the chewing efficiency compared to natural teeth, whereas dental implants actually have a chewing efficiency similar to that of a natural tooth. First of all, patients need an injection, and generally we'll make an incision in the gum tissue to expose the underlying bone. Once we do that, there's a process, there's a drilling sequence which we use depending on the length and the width of dental implants. Once we determine the length and the width, then we know the exact implant that we need. And once the implant's placed, generally we'll wait a certain amount of time to allow the implant to heal within the bone. However, there are circumstances where we put implants in and we put a tooth in immediately. Generally, we do that in areas, high-esthetic areas in the front of the mouth. We put a dental implant in. We certainly don't want the patient to leave with a space. So generally, with respect to implants, like I said, implants placed in the back of the mouth, we generally will wait for those implants to heal within the bone. If it's in the front, using certain principles that won't put too much stress on the implant, we'll put in an immediate temporary tooth. Dental implants can last for an indefinite amount of time. Once a dental implant is placed, if it's done properly, and also provided that the patients take care of it, dental implants can last as long as a natural tooth. Dental implants, according to the literature, have a 90 to 95% success rate. And that success, they don't survive, but they actually succeed, and patients are able to use them, and they look and function just like natural teeth. Dental implants, once they're placed, they function and look just like natural teeth. The chewing efficiency that someone will achieve with a dental implant exceeds that of alternatives, which most alternatives are removable dentures. They really have about 10% of the chewing efficiency of natural teeth, whereas dental implants actually give a chewing efficiency similar to natural teeth, if not more. Procedure to start a dental implant is just like procedure to have a filling, a root canal, gum surgery. You have to get the patient numb. Once the patient's numb, dental implants go as smoothly as a filling, a root canal, gum surgery, and patients are always amazed at how little pain they felt based on what they were expecting. Dental implants can pretty much be used on any patient. With respects to the criterion, really patients have to have enough height and enough width of bone. If they don't have the adequate height and width of bone, we're able to create that. We're able to do the process of bone grafting, soft tissue grafting. We, in most cases, can prepare a patient with deficiencies. We could prepare them to have dental implants.